internal jugular vein and brachiocephalic veins. So in this we will be discussing competency, that is origin, course, relations, tributaries and termination of internal jugular vein and brachiocephalic veins. Internal jugular vein. Internal jugular vein is the principal vein draining head and neck area. It descends from jugular foramen, that is from the base of skull to the neck. It lies lateral to internal carotid and common carotid arteries. Hypoglossal and spinal accessory nerve pass in between the above, that is internal jugular vein and carotid arteries. It continues to descend downward to join the subclavian vein. Tributaries. You can see in the picture. Tributaries of the internal jugular vein. Inferior petrosal sinus. Second is pharyngeal vein. Third is common facial vein. Fourth is lingual vein. Fifth is superior thyroid vein. Sixth is middle thyroid vein. And seventh is occipital vein. All tributaries of internal jugular start in the anterior surface of neck. So in the picture you can see it is the internal jugular vein is formed by joining of sigmoid sinus with inferior petrosal sinus. Then in the lower part of neck it joins with subclavian vein to form brachiocephalic vein. Lymph openings. On the left side it is thoracic duct. Right lymphatic duct opens on the right side into the angle of union between internal jugular and subclavian veins. Then right brachiocephalic vein. So in the picture you can see right brachiocephalic vein, left brachiocephalic vein joining to form superior vena cava. It begins by the joining of right internal jugular vein and right subclavian veins. Posterior to the sternal end of clavicle. Right phrenic nerve, internal thoracic artery and vein or its lateral relation. Thymus gland and brachiocephalic artery are medial in relation. Formation of superior vena cava. The right joins the left brachiocephalic vein at the level of lower border of first right costal cartilage to become superior vena cava. Tributaries include right vertebral vein superiorly and internal thoracic vein laterally. Other tributaries or some more tributaries include anterior mediastinal veins, pericardial veins, sternal veins, anterior intercostal veins in the upper 6 intercostal spaces, occasionally the right superior intercostal vein and inferior thyroid vein. Then we go to left brachiocephalic vein. It is longer than the right. It is 6 centimeters in length, beginning behind the sternal end of the left clavicle and progressively obliquely downward and to the right behind the manubrium sternum. It unites with the right brachiocephalic vein behind right first costal cartilage. Right first costal cartilage. Relations. The posterior relations include innominate artery, then left common carotid, left subclavian, vagus and phrenic nerves. Tributaries, they are similar as on the right side. Left superior intercostal vein drain draining the upper 3 or 4 intercostal spaces, inferior thymic veins, and pericardial tributaries. Coming to another competency, that is clinical features of the compression of the subclavian artery and lower trunca brachial plexus by the cervical rib. So in this picture we are seeing the scalene triangle. Scalene triangle is bounded by inferiorly by the first rib, anteriorly by the scalenus anterior, posteriorly by the scalenus medius, and its contents, normal contents include in the lower part, that is the subclavian artery and lower trunca brachial plexus. But there is an additional content here, that is cervical rib just above the first rib. Clinical features: paresthesia and pain in the middle ring little fingers on the affected side, more often during night time. History of fatigue and pain while writing and working on computer. There is problem carrying things in hands, especially when the arm pulled in axial direction. Lifting of arms above shoulder plane can elicit similar symptoms in the fingers on the affected side. May experience intolerance to cold. Pain in 3 ulnar fingers during abduction of arm above 90 degrees. Impaired internal rotation, adduction and extension. That is hand on the back on the affected side. Palpable cervical ribs. Positive Froment sign. Thank you.